Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
At the Mayo Clinic, the primary guiding principle or value for all of us is the needs of the patient come first. Now, one group who helps carry out that mission is the Mayo Clinic volunteers. Mayo volunteers provide patients and visitors with hospitality, services, and amenities that help make a visit to the Mayo Clinic a little more pleasant, a little more enjoyable, even if you're ill.
Volunteers are very important all across the world. Well, volunteers at Mayo Clinic give tours and information. They work in libraries, stores, and patient treatment areas, and they even offer some very popular services like caring canines and hand massages.
Oh.
Here to discuss is the Director of Volunteer Services at Mayo Clinic, Rochester, Kimberly Van Roy. Welcome to the program, Kimberly. It's nice to meet you.
Thank you. I appreciate the opportunity to be here and share a little more about what we do.
Kim, it's good to have you. This must be sort of a fun job.
It's absolutely a fun job, a feel-good job. So I feel honored to be representing our volunteers.
I would imagine, this program is heard across the country. I would imagine that any hospital relies on its volunteers and probably would like to give them a congratulations every once in a while. So I'm glad that you can do it for everyone.
Thank you.
So how is it different to be a volunteer at Mayo Clinic?
I think one of the things that I hear from our volunteers, and interestingly enough, we really don't have to recruit volunteers. We have a really full pipeline.
You have a waiting list?
For our young volunteer program, we do have a wait list,
Is that
yes.
right?
But when I talk to other areas in Rochester, they say, how do you get people? How do you get people? And they ask me what my recruitment strategy is, and I say, well, knock on wood, we don't have a strong recruitment strategy because we just have so many people that want to be part of this culture. And many of our volunteers have a family member that were treated here, or they were an employee and wanted to give back. I even have had folks relocate, true story, so that they can come back now in retirement and volunteer at Mayo Clinic.
Wow.
How many are there? How many volunteers? I know you have them all over the campus, I guess.
Right. Last year we had close to 1,600 total in Rochester.
What kind of training does it take to be a volunteer?
It varies based on what service area you're going to be in. So if you're going to do brochure deliveries, it might be a little bit different training than if you're doing caring hands, where we have a robust process, checklists. We send you home to do a little practice and then come back. So it does vary by each service area, but we do have standards and requirements and checklists for every service area, and we definitely make sure you're trained before we turn you loose.
You mentioned the hand massages.
Yes.
Let's talk a little bit more about that, because I know someone who wants to do that job. That's a pretty popular, is that becoming a popular one for people to volunteer for?
It is. And
it seems strange the first time you hear it, that you want to volunteer to massage people's hands.
Well, the people that do it say they get so much more out of it than what they give. And it's not just the massage. It's also really listening and sometimes just being with that patient. It's really neat to be able to go in and be part of the, we say, healthcare team without having to give them medication or prob or poke them. And we actually published a research study with the help of integrative medicine to show that our patients on Gone to 10 that received caring hands massage prior to their treatment, they did better. They were less stressed, they had less anxiety. So we know that this works. We have published research now to back that up. And our our caring hands massage volunteers, they absolutely love what they do. And we provided over 8,000 of them last year.
You know, next time you come, you should bring one of those hand massage
Right, I should
therapists
have brought
with
one
you.
today,
Yeah.
right? Exactly.
Are there any age restrictions with regard to being a volunteer at Mayo? Can you be too young or too old?
So you have to be at least 14, but we do not have a cap on how old. So right now our oldest volunteer is 100.
And what are some of the other services that you provide? Obviously, hand massage is one of them and one of the most popular. I mean, there must be some training to do that, though, right?
Absolutely, yeah. There is a robust training protocol to go through that, and we also do have some annual competency or biannual competencies that we have them go through as well, just to keep skill sets up.
What about one of your other popular programs, the Caring Canines in dog years? How old are some of those volunteers? Okay, I won't make you you figure that out. But tell us about Caring Canines.
Sure. That is a partnership that we have with integrative medicine as well. And Jessica Smith, who is our partner in integrative medicine, she kind of handles the requirements for the dogs because that's a little out of our wheelhouse. But we recruit the volunteers. She takes care of the dog piece of it or the canine piece of it. Again, there are certain requirements. The dogs have to have certain certifications because whenever you're bringing an animal into a hospital, you have to make sure they're vetted appropriately, no pun intended. And there are about 30 teams of volunteers. Patients love the service. It's actually something that can be ordered through Epic, so care providers will order the service, and we get obviously great feedback on that service as well.
All right, other services you provide?
Yeah, you may have seen some of our volunteers at the welcome desks or providing wayfinding. So we try to take it one step further and walk the halls. You'll see that deer in the headlights look where people just obviously are not sure where they're going. So we wanted to provide volunteers to actually just walk the halls and say, can I help you find where you're going? Mm-hmm. And they will take them directly to the area they need to go. So that's kind of a unique one. And we promote that as if you want to get steps in, we're a big campus. If you want to get fit and help patients, this is the service for you.
You could do unofficial wayfinding because I've done that lots of times.
Absolutely.
When someone has that look on their face.
Right. One of the other things that's kind of a best kept secret is our handicraft volunteers. We have we made almost 20,000 handmade items last year, and that's everything from pediatric surgical caps to toe cozies. So if you break your foot in the winter, a little knitted toe cozy to go over the cast. Stuffed animals, you might see kids walking around with little stuffed animals that our volunteers have made. And I always say when I retire, I want to come back and have a backpack full of those and just hand them out to kids all over the campus. So that's going to be my volunteer role when I retire.
Fabulous. And the gift shops.
Absolutely. Yeah, 2 of them. We have Sisters Crossing and then the Methodist Campus gift shop. So, and a lot of people don't know that our proceeds go back to the practice. So the Poverello Fund, the Good Samaritan Fund, and then we also fund a lot of institutional requests. For example, an area needed iPads to better communicate with tracheostomy patients, and we funded that initiative. So we try to give back to the organization any of the profits we make. So if you shop there, you're really helping our patients.
As I mentioned, this program is heard on over 200 stations around the country. So let's say that someone is far away from Rochester, Minnesota right now, but likes to help out, likes to volunteer in their community, and is maybe getting an idea of some way they could help out at their local clinic or community. What's the first thing that you would suggest that they try?
Well, if they want to reach out to me, I'm more than happy to share what our model looks like. But I think the main thing is just knowing who to get in touch with in their hospital to make sure that there are different areas that are seeking volunteers. The patient experience area is another great area to kind of partner with because a lot of times they'll have information about areas that might want to increase satisfaction. And so I would suggest reaching out to hospital patient experience as a first step of getting into the door.
And if someone would like to contact you about volunteering at their local hospital or clinic, how would they do that?
So they can either email me directly at vanroy.kimberly@mayo.edu, or they can certainly call my extension at 284-5696 with a 507 area code.
And that's Van Roy with 2 O's.
Correct.
Kimberly Van Roy, Director of Volunteer Services at Mayo Clinic, thanks so much for being with us. You do so much good for so many. We really appreciate it.
Thank you so much. Pleasure to be here today.